My name is Dr. Keith Gray, and I am the Chief Medical Officer at the University of Tennessee Medical Center in Knoxville. I chose to be vaccinated today to prevent being infected with the COVID-19 virus. I understand that many in the minority communities have a lack of trust for the healthcare systems at large, based on the history of healthcare for minority populations in this country. I think things are different now. I think the healthcare system, especially here in Knoxville, is a place that can be trusted. I think we've proven that to our community, to all members of our community during this COVID-19 pandemic. Because COVID-19 disproportionately impacts minority communities, I think it's even more important that members of the minority community consider being vaccinated. COVID-19 has not disproportionately impacted us because we are minorities, but we know that those comorbidities that put you at risk are more prevalent in our communities. I'm proud to say that minorities were strongly represented in both the Pfizer trial and also the Moderna trial, specifically the Hispanic and Latino populations and the African American populations. And so we now have data from the trial that we think is representative of the entire population and applicable to us as minorities. So based on that, I feel safe, and I feel like the results of the vaccine trial can be applied to the minority population. My vaccination process was safe and quick. Let me walk through the process with you. At the first stop, I was met by a greeter who confirmed my appointment time, made sure I hadn't been sick, and made sure I hadn't taken any pain relievers in the last 24 hours. At the first table, I received a consent form to complete and also a fact sheet about the vaccine and information to consider when I would be available to take my second shot. The first station was set up for registration. The information that I had completed on the consent form was used to register my information into the Tennessee vaccination database. Adjacent to that station, I was now ready for vaccination. I was again confirmed that I was feeling well and made sure that I hadn't had a vaccine in the last 14 days. I was given a shot in my left arm, which again was quick and painless, and I experienced very little soreness for less than 24 hours at the site. At the end of the vaccination, I was urged not to take pain relievers for the next 6 hours and to not receive any additional vaccination for the next 14 days. At the next stop, I was asked to schedule my second vaccination 3 weeks later. They asked me to schedule it on a day when I might be able to rest more on the following day, just in case I had any side effects. Lastly, I moved on to an area which was designed for a period of observation. Everyone sits for 15 minutes after being vaccinated to make sure there are no problems. For those who often have reactions to vaccines, they will sit for around 30 minutes or so. Pharmacists are in the room at all times, just in case anyone has a reaction. Once my observation period was complete, I was free to go. So I had my second dose of the vaccine about 21 days after my first dose. I chose to have it done on a Friday, just in anticipation of having some side effects. Fortunately, I just had some mild fatigue, obviously some soreness at the site, but otherwise tolerated the second shot very, very well. But I do want to make you aware that the side effect range is varied and broad. Some people have really no side effects after the injection, except for some soreness in the arm, and others may experience a fever, muscle aches, chills, and joint aches. I am very grateful to have received the COVID-19 vaccine. I hope it is a source of encouragement for those of you that have had some trepidation or fear around vaccination, especially around the COVID-19 vaccination. I hope you see it as a source of personal protection and a way that you can protect your community.